If you're a patient with dense breasts like me, you might find yourself worrying every year about a breast screening experience that can be painful, uncertain, and anxiety-producing. Existing options are very uncomfortable and have flaws. It's very clear that a problem exists, and it has for a long time. There has to be a better solution. Every year for the last 10 years, more than 40,000 women have died from breast cancer. We need to find cancers earlier, but there are things that stand in our way. One clear problem is that many patients don't like the experience of early detection screening, so they simply avoid it. Patients hate uncomfortable breast compression, and patients fear radiation exposure. So many patients that should get screened don't even show up. But there's another very specific problem with patients with dense breasts like me. Mammography misses up to 40% of cancers in dense breasts. Wow. And 40% of women have dense breasts in the US. This makes this a very huge issue. Why is finding cancer so difficult in patients with dense breast tissue for the traditional gold standard mammography? Because on mammography, finding cancers in dense tissue can be like trying to find a snowball in a snowstorm. That's understandably hard. Mammography and other current options have done their very best, but we clearly need a new technology for patients with dense breasts. It's also important to recognize that patients with dense breasts need special guidance to consider additional options. That seems obvious, but don't take my word for it. A majority of states and the federal government agree and have implemented or are in the act of implementing breast density notification laws to make sure patients are informed of their breast density so they can actively pursue additional options. But laws simply aren't enough. Why? The language in these notification letters is vague, and people are not sure what to do or what to think when they get these notification letters. What does this mean? Should I be concerned? Do I need more imaging? What kind? Will insurance even cover the exam? Laws simply are not enough, especially when the technology options available fall short for patients with dense breasts. We need a technology that sees more cancers in dense breasts and delivers an experience that's more comfortable. SoftVue is the answer. What is SoftVue? SoftVue is a no compression, no radiation, water-based ultrasound tomography system that lets patients with dense breast tissue supplement their mammogram on the same day. Not only is SoftVue a comfortable patient experience, but it saves you time, and it increases the likelihood of catching cancer earlier. In fact, SoftVue in combination with mammography increases cancer detection by 20%. It can decrease unnecessary callbacks, and it's covered by existing insurance codes. So SoftVue is a game changer. And now it's approved to serve dense breast patients like us. It's a better experience for patients, and it increases cancer detection. That's what makes SoftVue the solution to the dense breast screening challenge. I invite you to learn more at delphinusmt.com and talk to your doctor about SoftVue. And if you have questions about your overall breast cancer risk, visit operationbreastdensity.org.